Hello again. I'm going to talk about the chapter on celiac sprue. So celiac sprue is something that's been brought up a lot in recent years, even though it only affects about 1% of the population in the United States. What celiac is a food allergy, one of the best food allergies that's been documented. It is characterized by sensitivity to gluten, which is found in wheat, rye, and barley. It involves the lining of the small intestine with inflammation there, and there are antibodies that are present. The symptoms are usually bloating, gas, and diarrhea. There can be weight loss. It can cause iron deficiency and folic acid deficiency as well. Can cause some increase in bleeding tendency, can cause neurologic symptoms, weakness, numbness and tingling, balance problems, and seizures. Anemia or low blood count can occur from iron deficiency and folic acid deficiency. Can have osteoporosis, osteopenia, meaning thin bones that are prone to fracture. This can be from vitamin D deficiency. Can develop a particular type of rash, which is vesicular, meaning small collections of fluid, like little bubble-like spots on the skin that itch. These tend to occur over the buttocks, scalp, neck, elbow, and knee areas. It's called dermatitis herpetiformis because it looks like herpes. Lactose intolerance is common because lactose, the sugar in milk, is absorbed in the same area that celiac sprue attacks in the small intestine. Liver enzymes can develop in about liver enzyme abnormalities or elevations in about 20 to 40% of patients. There are people that have sensitivity to gluten but really do not have celiac sprue. So it's more of a gluten intolerance, like lactose intolerance, but you don't get cellular changes or biopsy changes in the small intestine. So the prevalence, about 20% of people will have gluten intolerance. 3% will have a separate entity called wheat allergy, which is not celiac sprue, and about 1% have celiac sprue. Celiac sprue has been popularized in the media, unlike lactose intolerance. So I think it sounds a little exotic. People want to be different. They don't want to have just plain old lactose intolerance, and so it sounds like it's a little bit exotic. Some experts have said that it's difficult to dissuade some patients from that diagnosis, and one of the experts in celiac sprue described such patients as celiac wannabes. A number of patients are simply put on a gluten-free diet and told to follow that, which is not an easy thing to do. But if the patient is on a gluten-free diet and they come in for an evaluation, it makes it more difficult to diagnose them because the antibodies for celiac sprue and the small bowel biopsy changes will not be present. There are blood tests that can be done, such as HLA typing. That is human leukocyte testing is HLA. And you're looking for DQ2 and DQ8. If the patient does not have either of these, then it's 99% chance that they do not have celiac sprue. Otherwise, you can stop their diet take them off of the gluten-free diet for 3 months if they'll do that, and then go ahead and do the testing, the antibody testing, and the small intestinal biopsies. There are some patients that do not have celiac sprue, but have biopsy changes that look like celiac sprue, and they may, if they've been to the tropics, they may have what's called tropical sprue. So it's important to note that the patient will need to be in the tropical area, it could be South America or somewhere else that's tropical, for at least 1 month. And if they have tropical sprue, then they should respond to antibiotics, long-term antibiotics. Has to be taken for 6 months or so, as I recall, and folic acid. So I had such a patient, and she was in the civil service. She was in South America for longer than 1 month. Came back, looked like she had celiac sprue on biopsy, but her antibodies were negative. So I diagnosed her as tropical sprue, put her on tetracycline for a number of months and folic acid, and she resolved the problem. And later on duodenal biopsies, there was no evidence of celiac sprue or tropical sprue. So the main treatment for celiac sprue is dietary, and it's important to have a good dietitian here and not one who's seeking cowboy and cowgirl types of diets for profit. And there's a lot of that, I think, that's going on. There is a website, csaceliacs.org. That's csaceliacs.org. Has very good information on diet and the recipes as well. Should be noted that there's a drug called olmesartan, which is Benicar, which has been found to cause celiac sprue changes in the small intestine and celiac sprue syndrome. However, there's no celiac sprue antibodies. That medication certainly should be changed if the patient has celiac symptoms and certainly biopsy changes. There has been some concern that there's increase in heavy metals in a gluten-free diet. There are some papers and literature out there on that, but it's not really clear that the amount of heavy metals that are in such diets are of significance. So it's one of those things to follow, but that also makes it important to know what you're treating. With gluten intolerance, one simply may avoid certain foods that cause symptoms. In celiac sprue, you're really talking more of trying to have a completely gluten-free diet if possible. It's important to follow up with the doctor, follow up small intestinal biopsies with the scope may be important. Certainly the antibody tests need to be followed, and vitamin levels need to be obtained to make sure that all is in order. If a wheat allergy is suspected, appropriate allergy tests, and these may be blood tests or skin tests in the with an allergist involved, are key to making that diagnosis or ruling it out. And that's all I'm going to say about celiac sprue at this time. Thank you.